All right, chiropractors, if you are like me, this is your very favorite subject to dive into, the science of subluxation, the neurology of chiropractic. That's what we're talking about in this video. So square off your time here, lean in and listen to this one because we're going to get really nerdy, but we're going to get really tactical and practical, meaning this is what you need to know about subluxation and what it's doing to the nervous systems of your patients. Specifically, so I'll start with chiropractic, period. Like this is what subluxation does. These three parts. They do it to every patient, any person, any age with subluxation. But obviously it's me. We're going to talk about exactly what this does to the pediatric population and to the developing brain and to a child's life. So here's the deal. Subluxation, when it gets into the nervous system, because remember, that's what subluxation is. Stop starting the conversation with subluxation being a spinal problem or a vertebral problem or a biomechanical problem. We know that it starts there. We get it. Dyskinesia, misalignment, fixation, disafferentation. Yes, but the problem is the moment you begin the conversation with making subluxation a spinal structural problem, you literally stay there in the public's eye. See, I know that you carry the conversation forward. You're like, hey, the spine, then the nervous system. Skip the spine. If you're a PX member, you've already been trained in this advanced communication, if you will, which isn't advanced at all. It's just understanding them, parents, patients. And if we talk about the spine and when they're looking at the spine, they're not going to see the nervous system. They're not going to hear us talk about the nervous system. So that's actually not the intent of this training video. But what we really get to is the subluxation is a neurological issue. Subluxation is way beyond a fixation or what you can see on an x-ray. Subluxation inside the nervous system does these three things. Number one, it increases tension. So what we're going to get is we're going to get an excessive sympathetic response. The first thing subluxation does is it pisses off the nervous system. It winds up the nervous system. It creates that level of distress and sympathetic excessive fight or flight response. The second thing it does is really the first thing. It's just the two parts of it. The second thing is exhaustion. So the first thing is tension. The second thing is exhaustion. Now we start to see parasympathetic fatigue set in. We start to see the nervous system just not be able to keep up. So inefficiency, exhaustion, what we like to teach our patients all the time. This is a phrase. We never communicate from scripts, but we do have our go-to phrases: perfect storm, gas versus brake, neurofuse. And in today's world, if you really want to make chiropractic relatable to your patients, including teenagers and pediatrics, then you can talk about how the nervous system for so many people and kids even is wound up and worn out at the same time. But actually with this video, I want to get into the third nastiest, gnarliest, life-destroying component of subluxation, and that is confusion. Now, confusion is the word we use for parents. Confusion is the word we use when we're talking to the public. I'm talking to chiropractors with this video, and I'm going to teach you the advanced understanding of chiropractic. And then the more advanced and the better you understand it, the more you can simplify it. See, the best communicators of chiropractic are the ones who understand it the most, because when you really have that, you can simplify it for others. When you don't really understand chiropractic, that's when you tend to verbally vomit and have confused patients. So if you're struggling right now with getting patients in the door, converting them into care, and really moving your patients in your community to a neurological model of chiropractic, you actually have to go back to square one and you need to study the neurology of subluxation and chiropractic further, because you're probably just not certain, confident, and clear enough to then simplify it. So the third component of subluxation in our world that we can go deeper on is called incoordination. Okay? Or that dysfunctional dysregulation component of subluxation. Now, if we go back 100 years and we dig into Dr. Stephenson's textbook, the Chiropractic Textbook, and we know that Dr. Palmer and Dr. Stephenson and everybody in the early foundational time of chiropractic, they almost exclusively talked about chiropractic subluxation in terms of incoordination and the confusion it puts to the nervous system. The Chiropractic Textbook is such an incredible read because they take that one thing, incoordination, and they write hundreds of pages to explain it through the philosophy and science of chiropractic. So we're not going to do 100 pages of review in this video, but I will tell you this: the incoordination and the confusion part is the nastiest part in terms of health components for our patients. The second part is the second worst part, the exhaustion part. The first part is actually a pretty normal part of life. Human beings tend to wind up, drink coffee, and get after it pretty easily. So the body can adapt to that for short periods of time. Where health really starts to run into trouble for kids, we're going to get into kids next, is when the exhaustion and then especially when the confusion sets in. So what does that look like? First off, when you have incoordination, this confusion, this discombobulation of the nervous system's function, for a child, what's thrown off is, yes, all the organ and glandular functions just like an adult. But the first thing we really want to pop the hood and look at with this video is their development. The neurological brain-based development is thrown off because of subluxation. First off, when they get into that fight or flight response, too much sympathetic, too much parasympathetic, they're stuck in protection mode, and you can't be in growth and development mode. That's Dr. Lipton's quote, which has always been a foundation of my work with The Perfect Storm. I teach that to every chiropractor, every parent ever in this context. You can't be in growth and protection at the same time. So the first thing subluxation does is it gets development stuck, slowed, stalled out. But the next thing that subluxation does to a child's development and a child's health is that confusion. So what happens is when subluxation, sympathetic dominance, parasympathetic exhaustion are in there, the gut function, the immune function, the sleeping function, and the motor function. So we call these the neurological soft signs, or the pillars and foundations of neurodevelopment. They don't fully develop because it takes coordination, it takes clear communication and connection between the brain and the body. So through that central nervous system, through that neurospinal system, there can't be subluxation in the way for the child's gut, immune system, respiratory system, digestive system, motor system, sleep system. Those things got to develop all the way and mature in those first couple months to years. And so if they get subluxated and stuck and confused, the gut, the immune system, the respiratory system are all incoordinated, that kid gets sick. Right now, the world wants to make such a big deal, rightfully so, about the gut brain and the microbiome and how much the gut is the second nervous system. It is. Which also means it's not the first nervous system. If it's second, it's not as important as primary. So our profession has also, a lot of us have gotten we're chasing this whole, let's talk about the gut. The primitive reflexes are secondary to central nervous system subluxation. Tongue ties are secondary to increased tone and tension on the central nervous system. So most of what the world is caught up in Facebook groups and Google searches is secondary or tertiary to neurology and to subluxation. So then the confusion continues. And if a child's gut, sleep, poop, those basic functions aren't coordinated and developed, what chance does the brain have of developing in full connection and coordination of socialization, speech and communication, behavioral and emotional regulation, sensory processing, and eventually even cognition, focus, memory, and learning. And so subluxation wreaks havoc on everything. You can take just this one component of subluxation and you can use it to communicate the power of chiropractic in helping gut issues, immune issues, motor issues. You want to talk about motor challenges? We have done a ton on our platform about milestones and motor function, gross motor function. And that world, parents who are seeing PTs, OT, speech, they understand about tone and incoordination. And so when they start to learn about subluxation, it's an easy connection and an easy correlation for them to go, man, that's the thing. I've been trying to do all these OT, PT, speech therapy to improve muscle tone and coordination. Well, the muscle tone and coordination is off base because of the neurological, central nervous system, subluxation. I've been trying to get the gut better coordinated. I've been trying to get the immune system better functioning and less inflammation. Well, the nervous system, the vagus nerve, needs to be in charge of that coordination. So the third component of subluxation is the nastiest part. And I think you should watch this video 3 times. I think you should go within the next 30 seconds and sign up for the PX membership. And actually, I'd push you even further. I think you should sign up for our certificate course because it is 60 hours of this in-depth training and explanation online, and then a 20-hour certificate seminar, CEs, where you learn how to do it. Because that's what you need to do, is take these 3 steps, chiropractors. Number 1, you need to know it. I spoke about that earlier. You have to have clarity with depth of what subluxation does, but you also need to put blinders on. Too many of us go into advanced pediatric certification programs, and well over 50% of it has nothing to do with subluxation and chiropractic neurology. And when you start learning about that, you lose focus. You become subluxated, incoordinated in your understanding of chiropractic once you start learning how to be an OT, PT, and a vision therapist and a nutritionist, okay? So stay focused in your training, and that's step one. Number two, once you have the understanding of what the nervous system and subluxation and chiropractic really are about, you can communicate it. You can convey it. That is why the PX practices are the fastest, by far, growing practices, and our platforms on social and SEO are, because we can communicate it with clarity and simplicity in parent speak. And third, most important, they're all equally important. Third is you got to be able to deliver it. Do your clinical systems, does your adjusting technique handle both the tension, the exhaustion, and the confusion and incoordination? See, we built an entire clinical protocol system, an entire technique systems, meaning we use a multitude of techniques in one organized, repeatable, what we call neurotonal adjusting system. And we teach it at our CERT course with Life University in conjunction. That's why the certificate has more teeth than any other one out there. That's why the CEs are there. And you have to learn how to handle all three components of subluxation with your clinical systems. And most of us can't. Most of us don't know how to do that. How to address subluxation's tension with this technique. How to address subluxation's exhaustion with this technique. And how to address subluxation's incoordination with this technique and approach. This is advanced chiropractic simplified. This video hopefully lit you on fire, got you excited, and also is causing you to go, oh man, I got a ways to go. I'm 15 years in. I study this every single day, and we teach this every single day, which is why I have such clarity to it. Get in our crew, get in our camp, get into that certificate course, get your training with us, because then you can get this message with clarity to them. Then you can get those adjustments done all the right ways to them, and you can help these kids get back on track. You can calm their and release their tension. You can restore and recharge their exhaustion, and you can clear up the confusion in their neurodevelopment and in their neurophysiology. And when you do those three things, which is really one thing called chiropractic, you transform lives bigger, better, and far more than any probiotic, any primitive reflux paintbrushing, or any biofeedback. Anything out there, nothing out there can touch the power of chiropractic, but you need to know it with this depth, communicate it with this depth, and then deliver it with this depth. And to get there, you need the pediatric experience and our training and our certificate program. We built it for you, for them. I'll put the link in this one. Get into it, get after it. I'll see you at the next seminar.